My name is Cedric Jackson, and I'm a nurse practitioner student. And today I will be performing the examination of the lungs and thorax. This is my patient. Could you please state your name and date of birth
Tori Jackson,
and your date of birth?
5/15/88,
And could you state your race for me?
African American,
Also, the gender that you prefer.
female.
Again, today we'll be performing an examination of the lungs and thorax. Do you give consent to this examination?
Yes.
Okay. So, in a clinical situation, I will make sure that the patient's top is removed, where I can place my stethoscope directly on her skin for my examination. I would also begin by just inspecting her chest, just noting any deformity in the chest, also assessing her anterior-posterior ratio. And I'll just glance here, noting again the anterior posterior ratio. Hers is 1:2, which is normal. I would inspect for her respiratory effort, noting her rate of respirations. I would also note any use of any accessory muscles, any retractions. I would then go into just inspecting the skin on her chest, making sure there's no discoloration there. I will also assess her lips, noting the color there. And if I can see your hands, I would inspect the color of her fingers. Also, I would note any side noses or any clubbing of her fingers, and she has none of those. After inspection, I will go into palpation, where I would palpate respiratory excursion. So if you sit up straight for me, I will place my hand in the intercostal margins and with a female, you may have to remove breast tissue and all to feel this stuff. And so I would just kind of watch to see how the distance between my thumbs as she's breathing, making sure that it is symmetric, and it is. After that, I would palpate for tactile firmness. I would do this by placing my hand on the intercostal muscles and ask the patient to say 99 each time. So we're going to start with that. So each time I place my hand on your chest, if you wouldn't mind saying 99.
99, 99, 99, 99, 99, 99.
Okay. And I'll also check for costochondrial tenderness. And I'll just let me know if you feel any tenderness as I palpate the costochondrial joint of your ribs here.
No.
Okay, great. So after after palpation, I will go into percussion, where I will percuss the chest using my middle finger on my non-dominant hand, and also the middle finger of my dominant hand. And again, with the female, you will have the accent to help you move breast tissue to finish that assessment. After our percussion, I would go into auscultation, where I will auscultate her breath sounds. And I'm going to, each time I place my stethoscope on your chest, I want you to take in a deep breath, and you can exhale when I remove this stethoscope. Again, with a female, you have to ask them to help you move breast tissue. listen for any agitation of breath sounds, and I don't hear any. Okay, so that finishes the front of the chest. So I'll have you turn around if you wouldn't mind. Perfect. Okay, and then again, I will start with inspecting. In the clinical situation, of course, the top will be removed. Just go in by inspecting the chest. Again, noting any discoloration. Also, I would assess her inspiratory, her respiratory drive, noting she's using any accessory muscles or so. And after that, I will go into palpation. Again, where I will palpate the chest. I will start again with respiratory excursion. I will find the 10th rib, which is along in here. Again, placing my thumbs there, and just watch and see how my thumbs move the distance that she's breathing. Making sure they're symmetric, and they are. After that, I would assess for tactile firmness. Again, by making sure to place my hand in the intercostal spaces, and on the back, I will make sure to not place it along the scapula. So each time I place my hand on your chest, would you say on your back? Would you say 99?
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Then I would check for diaphragmatic excursion. I would do this by having the patient take in a deep breath and hold it. So when I tell you to, would you take in a deep breath and hold it? So take a deep breath and hold it. And I will, okay, you could let go or breathe out, I'm sorry. So I would mark that spot there. So noting where it is, noting that spot there. And so next I will have the patient take in a deep breath and let it out as much as you can to clean your lungs out and hold that breath. And from there, I will note the spot from where it goes from dullness to resonant, and that spot, and measure that spot on each side bilaterally to make sure that it's symmetric. So after that, I will go into auscultating the chest, actually her back, her posterior chest. Each time I place my stethoscope, would you take a deep breath in? Okay. All right, if you don't mind turning around again for me. There's also special tests that you can perform with this, and the test that I'm going to perform is going to be the whisper test. So what I want you to do, I'm going to place my stethoscope on your chest, and each time I place my stethoscope, would you kind of just lightly whisper 99? And the goal of this test is to, in normal situations, you should faintly hear 99 as the patient states it, but if you hear it loudly, you should be suspectful of lung consolidation. So this concludes my lung and thorax examination. Do you have any questions or concerns? Okay, thank you.